dinosaur species. So that symbolizes the Enterobacter. And then, on the other hand, the Serratia is also motile and produces the red pigment when it is cultured. And so, this ends up manifesting as pink ring that is found in the shower curtains. To remember that the Serratia is motile, think about the triserratial tops that is charging forward. As shown over here, it is kind of red as well. And that's indicated, or the bright red color of the triceratops, or triceratops, symbolizes the red pigment of the Serratia when it is cultured. And that is why you can see pink rings found in the showers if the shower curtains infected with Serratia. And then finally, the Klebsiella pneumoniae is a more high-yield bacteria to know. It is because it is a non-motile species. So think about the club-tailed dinosaur that is stuck in a jelly over here. The Klebsiella is also urease positive, so you can remember that by thinking about the patient over here spraying the dinosaur, the Klebsiella dinosaur, with the ammonia bottle, i.e. NH3. And then the Klebsiella has a large polysaccharide capsule. So think about the spikes that are covered in mucus. And let's see. Yes, so large polysaccharide capsule. And then the Klebsiella is associated with 3 A's. They're associated with alcoholics, abscesses, and aspiration. So you can think about the club-tailed dinosaurs. 3 A-shaped club tails. So there's 1A for alcoholics, 1A for abscesses, and a 1A for aspiration. And remember, Klebsiella has a large polysaccharide capsule where the spikes are covered in mucus. So that's how you distinguish Klebsiella from Serratia and Enterobacter. Now, the reservoir for these species are the human colon and the upper respiratory tract, and the transmission is through endogenous means. For pathogenesis, the capsule of the Klebsiella impedes phagocytosis. So you can imagine the macrophages having a hard time gobbling up this species because of the polysaccharide spiky capsules. And then the endotoxin they produce will cause fever, inflammation, and shock. And then for diseases, now these are typically more specific to Klebsiella pneumoniae rather than the Serratia or the Enterobacter. But the most notorious disease that the Klebsiella causes is pneumonia, which is why the term Klebsiella pneumoniae has the term pneumoniae in it. So this particular pneumonia is community acquired, particularly in a hospital setting. And it is most often affecting older males. And then it is most commonly in patients with either a chronic lung disease, alcoholism, or diabetes. Because remember, generations of cephalosporin